Namaskar, Sat Sri Akal, Adab. Good morning, good afternoon, and good evening to all of you. Thank you for joining our live session. My name is Kunjan Mawar. हम हैं आपके host और दोस्त for today's FB live session. Indian origin folks living in US. If parents are visiting from India and you are looking for affordable medical consultation, well, look no further. eGlobalDoctors has your back. If you are looking to contribute in televisits and build your network, eGlobalDoctors is formed by a group of physicians from UK, India, and USA. 300 plus doctors on board, 60 services, 8 plus countries. Provide consultation counseling services to patients from anywhere in the world, opportunities to provide charitable services to patients, be part of fast growing innovative telehealth company with chance to invest in discounting price, liability insurance will be provided. Visit or register eglobal.com for more information. In today's FB live session, we will be discussing about high blood pressure and its effects on the body. Dr. Sobha, she is a general practice with Grant Hospital, finished her family practice, Swedish Convent Hospital, moved to Missouri, did her internal medicine with nephrology fellowship, moved to California in 1986 and has been in private practice in California. And ever since 2020, she became full-time yoga teacher, heartfulness meditation trainer. Good evening, Dr. Sobha. How are you doing this evening?
Good evening, Kunjan. I'm doing good. Thank you for inviting me to this session. I am so excited to be part of eGlobalDoctors, and I have worked through COVID with eGlobalDoctors on the telemedicine, and I enjoyed it.
Wonderful. Thank you so much. We are happy to have you on our platform. So what do you say, Doctor? Should we dive in our today's topic right away?
Sure, I'm ready.
So I'm sure our listeners and our viewers are ready too. So our topic, just in case if somebody is joining us, our topic is high blood pressure and its effect on the body. So my first question is, what is a blood pressure?
We, as human beings, or any person, any live person, needs oxygenated blood to survive and to live. And this oxygenated blood is pumped into our whole system through the circulatory system, and the major organ being the heart. So the heart pumps this blood against the resistance of the blood vessels, and which gives the blood pressure to record on the manometer.
Wow, that's actually interesting. I did not know that. So thank you for that information. So, I have heard the term BP low ho gaya, high BP, low BP. So what is actually considered a normal range of a blood pressure?
So first, let us go over what are the two readings that we get when you check your blood pressure. One is called systolic blood pressure and one is called diastolic blood pressure. The systolic blood pressure, which is the top reading, is generated when the heart pumps blood into the circulatory system, into the arteries. That is systolic pressure. When the heart is resting between the beats, it generates pressure that is lower, that is called diastolic blood pressure. So the normal blood pressure usually is 120/80 or less. That is considered as normal.
Okay, so 120/80, as long as we are within that range, we should be good to go.
Yes.
Okay. So then the obvious question, then what is a high blood pressure? What does it mean actually?
High blood pressure means your readings on the top systolic blood pressure goes up higher than 139. So 120 to 139 is in the borderline. That means the resistance to pump the blood is more in the arteries for whatever reason, either it's plaquing or cholesterol or stiffening of the arteries due to the age. So the higher blood pressure goes up, and equally the lower blood pressure can also go up. That's called diastolic. Anything over 90 is called high blood pressure. Anything over 140 on the top figure, anything over 90 in the lower number is called hypertension or high blood pressure.
Got it. So 120/60 is good.
80.
120 over 80 is considered normal, and anything between 120 and 139 is
Like
considered high,
borderline.
but borderline. Okay, got it. So people who are listening, make sure your target is 120 by 80. That's the happy range or happy video. So what are some common signs and symptoms for high blood pressure? Like, how would I know, someone who does not have any medical background, how would I know that certain someone is actually showing signs of high blood pressure?
Most of the time, high blood pressure is asymptomatic, means you don't have any symptoms. That's why it is also called a silent killer. But some of you may have headaches due to high blood pressure. Some may notice blurring of the vision. Some may notice nosebleeds, and some may have shortness of breath or chest pain because of the heart enlargement from the blood pressure. And some may even develop kidney dysfunction or go into kidney failure because of the high blood pressure, because it causes resistance and the blood flow to the kidney is decreased. And you can have symptoms of clotting of the arteries in the legs, having weakness and pain in the legs. So you can have various symptoms. But the only way you know you have high blood pressure is for going for a regular checkup with your doctor or to a pharmacy. Just go to a pharmacy. They have blood pressure measurements in the pharmacy. Have it checked at least once a year, more often if you have high blood pressure.
Got it. Okay, thank you so much. So you used a word in the beginning, which is hypertension. So what is hypertension and how does hypertension affect our body?
Hypertension is same as the high blood pressure. Hypertension is more of a technical term. In the medical language, we use it as hypertension. How does it affect the body?
Yes.
So this high blood pressure, if it is not controlled, it can affect every system in your body. Starting from the head, you can have stroke, you can have hemorrhage into the brain, you can have hemorrhage in the eyes, and like I said, heart failure, heart attacks, and aneurysm of the arteries, which is dilation of the blood vessels that may rupture if it is undiagnosed, and kidney failure, and problems with the circulation in the lower legs. So it can affect almost any system in your body.
Wow. Okay. So people who are listening to us, if you are a patient of high BP, make sure you do go for your regular checkups like doctor was suggesting, or go to any pharmacy and do not let these symptoms slide. So hypertension, we were talking about hypertension, what is it, how it's affecting. So my next follow-up question is, what might cause hypertension? What might cause a high blood pressure in someone?
So the causes of high blood pressure are, one is a family history. If you have a family history of high blood pressure, you're more prone to have hypertension or high blood pressure. So make sure if your family has high blood pressure, check it more often at an early age. Otherwise, more common in the age group above 50 or above 65. And women, it's more common after menopause. And race, Africans are more prone to high blood pressure than white Americans. And stress-related habits like drinking alcohol, smoking, eating too much salt, or caffeine, increased caffeine intake, all this can predispose you to have a high blood pressure. Suppose you have a family history of hypertension. All these factors can aggravate and bring it out earlier than you're supposed to get it. And conditions like heart disease, kidney disease, and diabetes, overweight, sleep apnea, and stress can all aggravate high blood pressure and bring it out if you're prone for it.
That's actually good to know. So I was actually thinking in my mind when you said caffeine intake, increased caffeine intake. I know that a lot of people drink coffee and chai. So what is considered like a normal quantity, or what is considered an increment in caffeine?
Usually they say anywhere 2 to 4 cups is okay. But if you have a high blood pressure, especially if you're going to see the doctor and get it checked, you should not be drinking a large cup of coffee and go to the doctor's office, because it can increase anywhere from 2 to 5 millimeters of your pressure. But 2 to 4 is okay. It doesn't increase it. Normal conditions. Two to
Well,
four
my
cups
heart
of
rate
coffee.
increase anyway. Yeah, my heart rate increases anyway when I know that I'm going to see the doctor. So it's a good idea.
Yeah, it's a
Not
good
to have
idea.
caffeine.
Yes, yes, yeah.
Wonderful. So, staying on the topic of hypertension, if somebody has high blood pressure, are there certain body parts that might get affected more, or which body parts do get affected?
I would say the most important thing is the heart and the kidneys. Stroke used to be hemorrhage and stroke used to be the number one, but now we have a lot of medications that can control blood pressure. So the stroke incidence due to hypertension have decreased, but we still have kidney disease and heart disease that can be brought about by the high blood pressure, especially if it is not well controlled.
Okay, so I'm just processing the information. So for any viewers or listeners who are actually joining us right now, we want to tell you, you are listening to the FB session of eGlobalDoctors.com. We are live on FB, Facebook, and today for the very first time, we are live on Instagram as well. So hop on your devices and choose your preferred medium, Facebook or Instagram. You should be able to hear us live. We have Dr. Sobha with us, and we are talking about high blood pressure. So going back to our topic, in between you were mentioning about kidney, so I'm gonna switch the gears and I'm gonna talk about kidney. So if somebody has high blood pressure, can they have a chronic, is it okay to say, or is it okay to assume that they will actually have a chronic kidney disease, or what should they do and how should they follow up with the doctor?
Okay. First time when you're diagnosed with high blood pressure, when you see the doctor, the first thing they do is do the routine test, the urine test and the kidney test, and make sure there is no other illness that is causing the high blood pressure. Like kidney disease, if you have it, it itself can cause high blood pressure. Like that, obesity, diabetes, all these other things, sleep apnea can produce hypertension. So the primary doctor will rule out all the illnesses that can cause high blood pressure. And then it is called idiopathic hypertension, means you don't have any primary cause, you just have high blood pressure because of the stiffness of the blood vessels, because of the family history. So it needs to be controlled with medications. So that is high blood pressure without kidney disease. Whereas if you have a kidney disease, maybe related to nephritis, maybe related to diabetes, or maybe related to lupus, other illnesses that cause kidney disease itself can produce hypertension, high blood pressure. Because when you have kidney disease, you retain salt and water, which can increase your blood pressure. And you have decreased blood flow to the kidneys, which causes high blood pressure. So in these cases, they have both high blood pressure and chronic kidney disease. So it is very important for them to control the high blood pressure to almost normal or below normal ranges, so that their kidney function doesn't get worse with time. And there are some medications that are work well when you have kidney disease and high blood pressure to protect the kidneys from getting worse in the future. Did I make it understandable for for you?
Yes, yes. You actually broke it down to very simple language, and that's what I like about it, because then it's so easy for me or someone who does not have a medical background to understand. And this question was asked someone asked this question, so hopefully they are listening to it and they got some clarity on the question. So thank you for shedding some light, and thank you for boiling it down to someone like me. So with that, I am going to go to some complications. Like if somebody has hypertension or high blood pressure, what are the complications? Like can the complications be controlled or uncontrolled, or some specific medications? So shed some light on that.
Yeah, most of the complications nowadays, we have great drugs to control blood pressure. Can be prevented if you see the doctor and get it controlled with medications. So like I mentioned, stroke, heart attacks, and kidney disease, all these things can be prevented if the blood pressure is controlled.
Got it. So so if we have high blood pressure, we have medications. Those medications will bring it to a level which, so that it doesn't go uncontrollable. And those medications, I'm assuming, is prescribed.
Yeah, all the medications that are used for high blood pressure are prescribed by the doctor. And so you need to see the doctor and get the prescriptions regularly. And
Got
it's
it.
lifelong. Don't stop the medications because your blood pressure is under control or you filled and finished your prescription. It has to be lifelong follow-up.
Wow, so they are your best buddies. You just keep them and keep taking them. Okay. Because I was going to ask that how long the medications should continue. So thank you for letting us know that. So is there a way, every disease, everything is preventable. So is there a way that we can actually prevent, or if we cannot prevent, can we manage our blood pressure?
Sure, there is always prevention, especially if you have a family history. You can overcome it, at least delay the process by, doing physical activity, means exercising, keeping your weight under control, decreasing the salt intake, eating more fruits and vegetables, avoiding smoking, avoiding alcohol, and decreasing the fat content in your diet so that you don't develop diabetes, which is also a risk factor for hypertension. And if you are snoring or if you're overweight, get the doctor checked for sleep apnea. So you can prevent it by using the CPAP machine. So these are some of the preventive measures that you can use it in your lifestyle management. It's a lifestyle management. And if you are under stress, nowadays everybody is under stress, right? So you can do what you like. Maybe you like music, maybe you like dance or exercise or yoga or meditation, and social interaction with your family and friends. These are all the important factors in your lifestyle, which will decrease your sympathetic tone and increase the parasympathetic tone, decrease your risk for high blood pressure.
Wonderful. So these are some of the things that people can do, not to prevent or to manage their blood pressure. Now, I don't know if I have high blood pressure because I didn't get checked, but I would assume that I don't. So for people like me who don't know or who are oblivious or who think they don't have high blood pressure, any lifestyle maintenance that we should do so we can avoid, now that we know what could cause a high blood pressure?
I think everybody should eat healthy. Everybody should exercise. Everybody should try to be mindful of the stress and have social interaction.
Okay. So I'm going to ask, go ahead.
And sleep well. Sleep is very important to follow the circadian rhythm. and not stay up all night and sleep during the day. It doesn't work we're not made for that.
Well, sleep is my long lost friend, so I'm going to tell her, Doctor said, you come back to me. So, so thank you for that. So tell me, can exercise, I have heard like brisk walking, 30 minutes of light exercise. So can exercise and diet changes, like you said, eat healthy, can it actually reduce the risk? If so, right now the question is for the people who have hypertension. So does exercising and diet change health?
Yes, definitely it will help. It may decrease the amount of medications you're taking if you control your weight. Suppose you're overweight, you come back to your baseline, basic weight, and then you exercise regularly, you eat healthy, you may be able to decrease the amount of medicine you're taking.
Oh, wonderful. So if you don't like medications, there you have it. You can exercise and eat healthy to reduce the dosage of the medication that we are taking. So since we're talking on the diet, I wanted to ask you any food items that we should take. If somebody has hypertension, they should take any particular food that might help.
Yeah, there is a long list of foods that are good for high blood pressure patients or people, and most of them have antioxidants and flavonoids. So starting with berries, banana, berries, beetroots, and then chocolate is supposed to be good for you because it has flavonoids, and kiwi fruits, watermelon, oats because of the fiber content, salads, again, healthy and have a lot more fiber, and supposedly garlic, and fermented foods like yogurt, kimchi, and other Asian foods that are fermented, and lentils, because lentils have a high fiber content, and pomegranate is good, antioxidants again, and cinnamon is supposed to be good for high blood pressure. They have some small studies that said cinnamon is good for diabetes and high blood pressure. Nuts, of course, are good if they're not salted, but you have to watch out for the fat content. You can't eat a whole bunch of nuts, only a handful of nuts. These are all the foods that are good for you in general and for people with high blood pressure. Avoid processed foods because they have a high salt content. Avoid salty foods, alcohol, and smoking, like we said.
That's wonderful. I'm so happy that the list of the food items that they can take is actually big, long enough list so people can choose based on their liking. And fermented food is good because then dosa and idli is one of the options for everybody. So that's wonderful. So we have a question on our Facebook Live. Somebody asked the question, so I'm going to tell the question and hopefully you are listening to us. So the question is hypertension more common during menopause? And if yes, how can we prevent it?
Yeah, hypertension in women comes out or exhibits its features more after menopause. I think there is a protective role of the hormones. Probably, I'm not sure, but definitely hypertension is more common after menopause.
Okay, so it's not during, it's after. So make sure you take the preventive measures. If somebody is going through menopause, then they already know what they have to do.
Yeah.
That's
and it can happen, it can happen during pregnancy, hypertension. So make sure if you had it during pregnancy to follow it much more closer after pregnancy and menopausal age.
So anytime, is it safe to say that anytime our hormone changes, we should pay attention to hypertension?
Yes.
Okay. Thank you for that. So hopefully whoever asked this question, you actually got the answer. If you have any follow-up question, let us know. I have another question from FB Live for you, doctor. If someone has a sudden surge of blood pressure due to stressful situation, but it's normal at other times. Does it mean they have to have hypertension and they have to go on medication?
Now, if it is in very intermittent and it's very short-lived and it's related to stress, then it's indicating that we can work with our breath and we can work with yoga, meditation, or physical activity, how to reduce your stress. You can work with those things and see if it stays longer, then you need medications, obviously. And there is also what is called 24-hour monitoring for blood pressure. So these are the people that may be good for having a monitor placed on them to see how often the blood pressure surge goes up. If it is long, many times, then they may need medication. So they need to be watched by the 24-hour monitoring, more frequent monitoring in the doctor's office or at home.
Okay, so whoever asked this question, hopefully you were listening. So if it's a one-off, you probably don't have hypertension, but if it's a reoccurrence, then you better get checked and do what the doctor suggested. Someone, some people are claustrophobic, and when they get into those situations, the palpitations increases. So what about those times?
Those are the people who should do some breathing exercises. At least we are lucky that in India we do pranayama, breathing exercises. If you do left nostril breathing, it decreases your sympathetic tone, increases your parasympathetic tone, decreases the heart rate, decreases the respiratory rate, and decreases the blood pressure. There are some techniques and breathing techniques, slow, long, deep breathing will help you to calm down in those situations, brings you to be mindful of the situation. Learn meditation.
Yeah, that's wonderful. So I just want to remind our listeners and viewers today, for the very first time, we are also live on Instagram and Facebook simultaneously. So pick up your social media devices and hop on to your favorite Facebook or Instagram. You should be able to hear us live. So I have another question actually from our live, and that question is, what about use of herbal medications for managing blood pressure?
I would say you should check with your doctor. Herbal medications, some of them, if they're calming medications, if it is stress related, maybe it will help you to decrease the stress. But I would always check with the doctor, make sure that they don't interfere with your regular medications, and make sure that it doesn't have high potassium or high salt content or other ingredients that will interfere with your regular medications.
Wonderful. So people who are listening to us, thank you so much for sending the questions. That's what makes our actually session more interactive and amazing. And hopefully you guys are getting the answers that you are looking for. So I have another question from our live. And the question is, can you tell about drug-induced hypertension like steroids and hormone therapy?
Yes, if you have taken steroids for any condition like allergies or asthma or autoimmune diseases, then steroids can increase the blood pressure. One reason is they can cause increased salt and water retention and cause secondary hypertension. But it needs to be treated same as any other blood pressure. What was the other thing? Hormones.
The other thing was hormone therapy.
Yes, hormones definitely can increase the risk of hypertension. And I think that's why people, the gynecologists, obstetricians, they like to use the hormones for a shorter period of time, maybe 2 years, 3 years, not over a long period of time, because the risk of hypertension goes up.
Okay. Wonderful. Thank you so much for simplifying for us. Let me check. I don't see any more questions. So hopefully whoever asked the questions, thank you for asking. And that's what, like I said, makes our session interactive. And it's really amazing to see that people out there are actually listening to us and they are joining our Facebook Live. So thank you for making it interactive. And hopefully you got the responses you were looking for. So with that, Dr. Sobha, it's a wrap. I just want to say real quick about eGlobalDoctors. They have really amazing benefits health packages. If you are worried about your medical needs in USA, check out their various health packages, which is bronze, silver, and gold. And they have really fun stuff and amazing benefits. In those packages, you can choose your board certified doctors, which is from USA or India. Prescription will be provided. They have umpteen number of specialities, video consultation about 30 minutes, and this package can be used by you or any of your family members. And the response time is 1 through 3 days. So with that, Dr. Sobha, before I let you go, any word of wisdom for the people who are actually watching us right now?
Yeah, I would say I was so happy to be part of eglobaldoctors.com. You can get all the consultations on the same day, same time on the Zoom consult, which is not possible even in real life. So I was really happy to be doing that service to the patients during COVID time. I tell all my friends that was the best thing that happened, that we can get any consultation.
Yeah, that's wonderful. And thank you for vouching. So thank you so much. And thank you for sparing time your Friday evening and spending with us and educating us. I learned a lot, and I'm sure our listeners and viewers did learn a lot. So thank you so much. It's a wrap. Keep smiling, stay safe. And, until we meet again, thank you so much. Namaste, Dr.
Thank
Sobha.
you very much. Thank you.